Now that our patient has been checked in by our front desk staff, it's time for our clinical staff to take over their portion of today's visit. We typically see clinical staff gravitating towards our native iPad solution for our EHR, Emma. This is due to the ability to take photos straight on the fly and capture consent within an exam room. But they're also going to still be able to see that schedule in front of them, as you can see here on my agenda view. With our full suite solution, all of the information that is appearing on that appointment flow screen is going to move right on over into the agenda view here on the EHR side of things. In real time, as either patients are checking themselves in or staff is checking in a patient, those details are getting updated for every single user, so that way there's complete visibility throughout the practice. For an example, here's my patient, Ace Smith. I can see that she's already been checked in. Now she's in exam room 1. She's the first patient ready to be seen. It looks like a medical assistant has already brought her back. So let's jump into that visit and see what's going on. On the left-hand side of the screen, you're going to notice that I have past medical history filled out along with skin disease history, medications, allergies, etc. Now the beauty of this piece of our clipboard is that patients are able to enter all of that information themselves using the patient application as you saw from mobile check-in, or utilizing the kiosk when they arrived in the practice, or even making updates on that patient portal using their browser. All of the updates are customizable by the practice, meaning if the patient does send over updates, a practice can choose to accept or reject or make any tweaks to those updates that have been added. Moving your attention now to this end of the screen, you're going to notice that the chief complaint is also populating for me and even states that this is patient reported. So using one of those patient engagement tools, the patient has been able to fill out those details all on their own prior to stepping foot into the exam room for today. They have notated that they are here for psoriasis on their back and chest. They've indicated what medications they've tried and failed, what makes the psoriasis worse, and how long they've had it. The beauty of this, once again, is the patient's ability to input all of these details themselves. That way, when they do get pulled into the exam room, it's time to start the visit. The provider has all the history that they need, and it's time to start the care for today. That also includes a review of systems here below. Patients are able to report on that themselves using our structured review of systems. Now, even those questions going back to the chief complaint are structured, meaning because a patient selected psoriasis, we're now asking them psoriasis-specific questions to answer. Now, let's start today's examination. When we get into our exam sets, you're going to notice that these are pre-built along with all of the other content that you're going to see in front of you today. We have thousands of dermatology-specific chief complaints, plans, procedures, and prescriptions all within the solution so that practices don't have to spend time building templates because it's all preloaded for them, with the option to make customizations as needed. For today's examination, I'm simply choosing my above the waist exam. When I do, you'll notice all of these details are auto-checked based on that pre-built exam set that's given to me by Emma. I can simply hit done to capture all of those exam points in a matter of a tap. And right off the bat, you'll notice my diagnosis drawer populating here on the left-hand side. All of these diagnoses are listed within order of frequency by that provider. Emma has an adaptive learning engine running in the background. So what that means is as each individual provider taps through the solution, it's remembering the most commonly used impressions, plans, prescriptions, procedures, and more. And those are being suggested first for them on an individual basis. That way, it's really becoming intuitive with how each provider treats their patients. I'm going to stick with that psoriasis example. When I make that selection automatically, you'll notice on the right-hand side of the screen, my morphology drawer is now populated. Once again, you'll see that we've got pre-built dermatology-specific morphologies tied to my psoriasis diagnosis right here for my provider to use. We can make any edits if we need to, so maybe perhaps I'm adding a BSA or even a PGA. The provider has the option to add custom morphologies to build on this list or remove any of those that he or she is not utilizing. But this, as well as all of the other preloaded content, is really allowing providers to hit the ground running day one with Emma. Now that we've selected our diagnosis along with the morphology, let's start working through our plans for today's visit, starting with our counseling. When I pop into my counseling plan, here are a few things I want to point out to you. The first is going to be our diagnostic-specific MIPS measures. I can easily choose the appropriate response for each patient using the dropdown for these measures 337 and 410. Once those selections have been made and this note has been finalized, this is speaking directly to our built-in MIPS dashboard for this particular provider. With ModMed, we are our own MIPS registry and have our own database and dashboard integrated into our solution. You'll notice over here in our counseling blocks, you're going to see some S's highlighted in green. These are indicating sticky fields. So as I've mentioned previously, All of the content that we're seeing today has been added by our medical directors who are practicing dermatologists. With this verbiage that's being pre-populated, it is customizable. So as a provider, if they decide to make any tweaks, changes, edits to the verbiage in front of them, once they do it for the first time, it's going to stay sticky and remembered moving forward. This way, they're not reinventing the wheel for each individual psoriasis patient. If they have the same over-the-counter recommendations or expectations that need to be built, they're ready to go right out of the box. However, if there is something that comes up for a particular patient that is specific to that patient, as we know things do, I can just move to my patient-specific counseling. I can use dictation to add these patient-specific notes. Patient to discontinue over-the-counter moisturizer. And now that note has been added for this particular patient without adjusting any of my sticky fields. Next, we can go into our prescriptions. Within our prescriptions, you'll see popular prescriptions coming up first. Once again, this is based upon diagnosis and frequency. For today's visit, we'll say we're going to prescribe Humira for our patient. When I make that selection, here are a few things that you're going to notice. The first is that on the left-hand side of the screen, all of my details here have auto-populated for me. Therefore, I'm not having to reinvent the wheel for my Humira starter dose for my psoriasis diagnosis, but I can make any tweaks on the fly if needed.